as Amy had, we want to get through. And what we end up like at the end, we want to make sure we have enough time to answer all your questions. So I'm going to do a quick review of some information that we presented in the past, plus some new information. So our agenda today is going to be an update on the COVID-19 and talk about kind of what's happening now, give some highlights. Then want to talk about back to basics, make sure that people are understanding what they should be doing now, some recommendations that we previously gave out, and then also then get to the Q&A, which is really one of the main things that we wanted to happen today with this call. So taking a look here at the status update, as of March 16th, approximately midnight, or last night, the US, there were 3,802 cases that were reported, 69 deaths, 73 recovered cases. So right now we can still continue to start expecting the number of cases to rise significantly as we do more and more testing. So a lot of different places are starting to do some of that self-isolation and not going into work, and trying to not go to different areas where there's going to be a lot of people, and just trying to monitor their movements. So one of the biggest things that we can do right now is monitor what's actually happening in your communities and the different cases. So depending on where you're at and what's happening in your community is going to affect your response that you actually have with your credit union and what you're going to be doing. So like I said, we're going to go ahead and go through some of the quick information here about what's happening right now. As everybody, I'm sure, is aware, the different global impacts that we're having to the different supply chains, especially a lot of imported products or widgets, we'll call them, that are coming out of China. They're causing some supply chain challenges and disrupting different supply chains. Also with the financial markets, as everyone sees, it's going up and down, and it's a little frantic or hectic, we'll say, for right now. And then, as everybody has also heard, which I think sparked a lot of interest and reaction from the public, was the professional sports actually stopping their seasons for right now. The NBA had started, and the NHL, and I'm not sure about where you live or your communities where you're at, but I'm down here in Dallas, Texas. So I know one of the big things is we had a run on the grocery stores, and a lot of people were stocking up for what possibly, I guess, could happen if they get quarantined, that sort of thing. So I think everybody's starting to take the lead here. I know was reported to me earlier, out in Washington State, they are doing a little bit more than what's happening around the rest of the United States right now, because they've really been impacted there. But we all need to be monitoring. I'm sure everyone is, and we also need to make sure that we're not panicking and we're actually reacting to what's happening in our local communities, but keeping an eye on what's happening also in the larger picture in the states around us or counties around us, wherever we're located. So, one of the local things that are going on, as I had mentioned, you have your supply and demand with the groceries. I was at the grocery store the other day, and I was just talking to the manager, and they didn't expect to have a run on everything that they have in their store, all the dried goods, non-perishables, etc. So they hadn't expected that. Now they're ramping up their orders to make sure that they have enough supplies for everyone in the community here. And our local schools have actually closed. We had spring break last week. Now they've extended it a week. And we're going to wait and find out how long we may be out of school. We're starting to do the distance learning for the children, and churches, different events and things are actually getting canceled as a lot of people are, I'm sure, are aware. So places where there's going to be, mass gatherings, they're actually canceling those to help try to avoid the spread of the what they call community spread of the actual disease, so, and the virus. So we just want to make sure that we are taking care of and doing what we can personally to make sure that we're not out there and causing the spread of what's actually happening with the virus. So I know with the credit unions, there is a concern on how we're going to continue to keep functioning, and hopefully we can answer those questions in a little bit when we get to the Q&A here. I know credit unions and even here at O1 Operations, we put in travel restrictions just to try to help minimize the contact that we're having and commuting around and possibly infecting other people. Not saying that we're infected, but just to try to help keep the spread and the community spread they talk about low, and start kind of doing some, not personal quarantining, but isolation. Try not to go out into the community as much and have that contact. When you do have contact with other people, we want to talk about the social distancing. And even in the credit unions, in the branches, some places are actually starting to go to just closing their lobbies and do the drive-through only to help with the social distancing. And then also in some of the lobbies, some people, the counters are far enough where you have that 3 to 6 foot where you can actually still keep the lobbies open and help take care of the members. We do have,
Hey, Tim.
Yes.
This is Kirk Drake, CEO of Ongoing Operations. I wanted to add a couple of things in here. So I think Tim's on the right track. Obviously, cash is a primary source of transmission, so making sure your tellers, the people who handle cash, have options to constantly be cleaning hands, etc. Drive-throughs are a great option. I also think it's time to start thinking of the secondary impacts of this for your credit unions beyond the basics of social distancing and the stuff that we've heard a ton about. So, and those really come down to thinking about liquidity. What are you going to do for your members that are not able to make their loan payments? Are you going to offer skip-a-pay options? Or this is a great time to step in and be a hero for your member and be thinking about those things. It's also probably a good time to be thinking about if a panic set in greater, do you need to have additional cash on hand at your branches for a potential run or something of that nature? So, be starting to move into not where we are right now with schools closed and making sure our employees can work from home and that they've got, options. I heard a great option over the weekend where a call center was connecting the teenagers that can't go to school with the younger kids within their workforce. The call center was paying for those teenagers to watch the kids at the other people's houses. Obviously, still social isolation. You're not having as many people come into a contact, which will slow the spread of this. Not as good as not having any contact, of course, but a great way to support their employees and make sure they were going to have a workforce that was available. Another option, close the gym I go to, restricts the number of people that can be in at any time, and they shut off every other treadmill and every other weight machine so that you've got some natural distancing between everybody. So, do the same thing on your teller lines, right? Way to keep the branch open a little bit longer. Have reminders on your calendars to wash your hands 4 or 5 times a day, to set your branch managers out to go clean the equipment and sanitize that once an hour or after every member or something of that nature, and make sure you're communicating these things to your members that you are doing them, because that will help them feel better about the situation as well, and that keeps the economics flowing in that regard. And then all of that stuff being considered, really moving into the second phase planning for delinquent loans, members who have financial hardship, lose their jobs, all of those kind of things, and moving into that secondary planning side of this. And the credit unions that I've been talking to in Washington State are about 2 weeks ahead of the California and New York markets, and then those guys are about 2 weeks ahead of most of the other states in the country. And then, of course, we have probably 10 or 20 states that are 2 weeks behind that. So, be ready for all of those things, be looking ahead at what those credit unions and banks are doing in those states that are ahead as they face, shortages and restrictions on movement. California, if you're over 65, you're not allowed to leave your home. So there's things like that that are going to be, really, really impactful to your members, and we need to be prepared for. So, sorry.
All right, great. Thank you, Kirk. Appreciate that. So some other things that we also wanted to talk about is, like, as far as some next steps, these basic mitigation strategies I have up here on the screen are some ideas that we've shared in the past, and you should be doing these right now, or at least thinking about them. And then some other things that we need to start taking a look at, as far as Kirk had mentioned, liquidity and loan delinquencies, et cetera. We need to also start taking a look at our succession plans. If you haven't in the past pulled them out and taken a look at them, we need to go ahead and make sure that we are reviewing those and updating them as necessary. Should something actually, one of our senior team possibly get infected with the virus and be down and not be able to actually work. So we need to make sure that we know who is going to be actually in the succession plan, and they need to know also what their roles and responsibilities may be. Then also, I know this is kind of an unknown. We're not sure where the end is going to be at, but we also need to start thinking about, if we're going to start requiring our people to take PTO, should we have to shut our doors or limit our facility access, et cetera? And we need to start taking a look at then, how are we going to be dealing with the rest of the year once we come back from this and we start getting back into normal operations? If everyone's already used all their PTO or their sick leave or whatever you call it at your credit union, how are we going to make sure that they get time off, paid time off later in the year? Because this is still impacting us at the beginning of the year, and people are going to need to have some time off just to take those vacations, get that mental stress relieved a little bit because of all this anxiety and everything that's building up now, plus just with regular work as we go throughout the year here. Then here's some other mitigation strategies. I'm going to let you guys read these. These are, like I said, the things that we've actually shared before. But another next step that I'd like to share is also, as Kirk had mentioned, Washington State's credit unions are kind of leading the charge in what they're doing and how they're reacting to this. So one of the things that I would recommend is reaching out to the credit union leagues out there in Washington State and find out, hey, what are you guys doing? What'd you do to prepare, to try to just help improve your planning as we move forward? So I know that was kind of quick as we went through there, but like I said, we wanted to get to some of the questions that we've actually received when you were signing up or registering for the webinar here. And then we can also actually start taking some questions as we finish these up here. So taking a look at, what is the time frame for exposure and symptoms to and quarantine? Right now, as what they've said is, 2 to 14 days after exposure, the symptoms may appear, and then of course the symptoms are your fever, cough, shortness of breath. Once the symptoms appear, then the quarantine, you should seek medical attention, and then also then the quarantine will begin. So the quarantine will basically last as long as the person is sick and exhibiting symptoms, and then they'll have to get retested with the doctors. So what do experts see as a future track of the virus, and how long are we talking about dealing with the virus causing this disruption? Right now, it's really an unknown as far as how long this disruption may last. So we need to start planning, 8 weeks out, what's gonna be happening. I know the CDC put out a recommendation yesterday about canceling all events that are 50 people or more, starting immediately for the next 8 weeks. But that doesn't include schools, universities, even though schools and universities and other educational facilities are closing down. But conferences, parades, concerts, sporting events, et cetera, those sort of things is what the CDC is recommending against. And
some early, I'll jump in again, it's definitely some early signs here of how long this is going to last. I think United Airlines cut 50% of their capacity for it through the end of May.
Right.
So 9 weeks out. Delta cut it 40%. So they're not even expecting travel stuff to begin in any real form for quite some time. It's my expectation with our family that school's going to be out for at least 4 to 6 weeks. Which, as terrible as that is, I certainly support. I have 3 young kids, so that will be very challenging. But, I think there are indications that this is going to be a longer term thing. It's not a 2-week flash in the pan and everything's back to normal sort of state. The other aspects of that too. So I think in Washington State, I don't know that I've validated this from a fact basis yet, but it's my understanding from the people I know up there that all ICU beds are at capacity in the state.
Right.
So if we're at that phase, and I don't think Washington State has some huge number of cases in the grand scheme. It's 100. They probably have 400 or 500 cases in the state, and we're already at that spot. So this is, we're definitely seeing this is we have to flatten out that curve and spread out the number of people in the hospital system as much as possible.
All right, so best practices over here. I'd like to get a better idea of what some other credit unions are doing at this time, just to see if we're aligned. If we could, whomever sent that in, if I could get your contact information so I could actually take this offline with you, because I'm not really sure what you're doing right now, but so we could compare and get aligned. But some of the things that you, I'm sure, are doing, the list that we had, the mitigation strategies earlier, you could start with that, and we will be sharing out this presentation so you can take a look at that. So that will be kind of a baseline to just start getting information, make sure that you are getting in alignment and getting things done for your specific community and the area where you're at. What's OGO doing to ensure that when disruptions occur, servers down, et cetera, that communication is being pushed out to credit unions? We are actually a virtual company, so we can work from home and monitor systems. And once we find if there's something down or there's an issue, we will reach out to the credit union or credit unions. We send out communications, IT alerts through our messaging, 2 different messaging systems that we use to make sure that the credit unions are aware if something is happening, if there's maintenance or there's an issue with something. We use different messaging systems.
And Tim, there was a lot of questions about what is OGO doing, and a lot of our things that we're asking of credit unions is you should be touching base with your critical vendors to make sure that they're prepared. So ongoing operations, we've mobilized our crisis management team. We certainly made some travel restrictions and scheduling access into data centers, but we are business as usual right now, all functioning. We are prepared for any, for most scenarios here in terms of disruption to staff and things of that nature. We are predominantly a virtual company. About 75% of our staff are virtual. So it is a little more straightforward process for that. But we have been practicing on our communications, making sure all dates are up to, all of our dates, all of our communication threads are up to date. We'll be updating our credit union customers every Tuesday and as needed as things change. But it is totally appropriate for you to ask all of your critical vendors, what are they doing to react to the pandemic? So if you have any additional questions, we're happy to answer those during the Q&A. Sorry, Tim.
John, that's fine. Keep monitoring that, please. So I'm just going to keep going with the questions here, and feel free to break in as needed. So once again, the number 3 here, what are we missing from our BCP? If you could just give me your contact information, send it in here. I'll be able to reach out to you then, and we can talk about what you're missing from your BCP, because I have no idea what you have currently. The best practice here for the member-facing positions, tellers, MSRs, those sort of things, as Kirk had mentioned earlier, the social distancing, possibly shutting down a teller window, going with every other, taking a look at drive-through only, you're closing your lobbies. Make sure that you have some hand sanitizer out there, or people are washing their hands or taking breaks to do that. They have gloves. people may ask for masks, and if you have them, you can go ahead and provide them. And we just want to make sure that we let our staff know that we are here supporting them. We're giving them the supplies we need. Plus, we want to make sure that we're wiping down our areas, basic, simple hygiene. And this all goes into another question that we received, and I'll be getting to that a little bit later here. How do we sustain operations in light of a pandemic? Really, one of the biggest things that a lot of people are pushing for right now is remote workforce. You may have to have a few people that still go into the office and do work, but we want to limit their interactions while they are in the office. So some people may get a little upset because they have to go in and other people are able to work remotely. This isn't really the time. We have to kind of work with them and help them to understand, what the actual position of the credit union is, and then also how we can actually possibly maybe in the future get them remote access if their job actually permits. It may not, their job functions. Remote work, this is kind of where I'm not really sure what this question was necessarily.
I think it may have been a question in terms of VPN access for employees as they're looking to work remotely now.
Okay, if I could put that over to Shane. Shane, if you don't mind to discuss VPN access.
Yeah, so
a little bit, some concerns.
Yep. So yeah, definitely. We want to ensure that we are maintaining, the security of our environments as we allow our folks to work from home. Having multi-factor authentication on those remote connections is important. But as we go, into evaluating, allowing folks to work from home after we've done the evaluation of our business processes and ensure they can, we want to make sure that our environment has the capacity, that we have licensing, we have bandwidth, that our devices can handle the number of folks that we're going to allow to work from home. We want to make sure that our security tooling that do we have enough laptops that we're providing, and that our patching and antivirus all work, whether they're connected to the internet or via VPN, right? And we want to, if we don't have the supplies available, laptops, et cetera, as we look at the work from home and the BYOD policy, do our policies need update? How are we going to validate that these devices meet the requirements of having antivirus, that they're currently patched, anything, and I caution you to go the BYOD device or the BYOD path very that shouldn't be the first place, right? We should be providing our employees, hopefully, the devices they need. But if we find ourselves in that path, we need to make sure that we're addressing all of the basic security tenets that we have in our internal policies, right? Because we're allowing these folks to attach to our network, and just ensuring that the VPN only allows access to the resources that they need. Can we connect them to their internal computer versus giving them full network access? What applications do we need access to? And then, thinking about items like what services that we have to have access to are location-based. Do our service providers only allow access from inside our networks? Have we made provisions for that? So just a couple of the things that we need to look at for remote work and VPN.
And along with that, Tim, we got a follow-up question here of what are other credit unions defining as trigger points for closing their lobbies and mandatory work from home for employees?
So right now with the different trigger points that people are looking at is if schools are closing, is that a trigger point to go ahead and start having people work from home? Because a lot of your workforce is actually going to be that have children, they're going to be actually staying at home. So that could be one of your possible trigger points. I know some of the credit unions I work with, that is a trigger point for them to actually start having some people, not all, work from home. And it could be to the point where once the local community actually has start having an outbreak, then that's when we start closing down the lobbies to the different branches that we have, start pushing the online functionality and features and systems that we have for the different members of the credit union. So it's really going to be dependent on what your risk tolerance is for your credit union in your area.
Yeah, I think another trigger point beyond schools being closed is, when we start seeing restrictions on gatherings of more than 50 people, which is probably similar to when the school closing occurs or when restaurants are forced to close. Those to me are good points to consider, that just follow the norm in that respect.
Right. Okay, so some important items you should include in your work from home policy. As Shane had mentioned before, this is really, really key. Define the security requirements that you're going to have, what people are going to be connecting to, what they're going to be doing, how they're going to be doing, etc. You want to set some productivity and performance expectations with them. While you're home, you're just not just surfing the internet, and monitoring email. You actually have to get work done from home. And it should be set in the policy where these are the days that you're supposed to be working, the hours that you're supposed to be working, and there may be certain days that they cannot. You set in the policy that they are not able to work from home, where it's like an all staff meeting or something where they have to come into the office for that. So you can put those certain specific days into your policies, and then also have in your policy the acceptable reasons that you would be able to work from home. So when somebody starts to request being able to work from home, does it fit into our policy? Is it one of the reasons that we're saying that we're going to allow people to work from home? And then outline the communications, how things are going to happen. What is the responsiveness and the availability that they need to have during the day, during the actual work day. Let's see. The number 4 here, what are other organizations doing when schools are closing? Their employees are impacted. Kirk stole a little bit of my thunder there with the call center and matching up the teens and the young children that are out of school. But that is an idea. It doesn't totally limit and isolate everyone, but it is an idea. And a lot of places, what they're doing is they're actually looking at the work from home, the ability to do that. And I know a lot of people, a lot of credit unions and businesses are like, well, the security, I get it. But if you go through and you get help and assistance, if you're not well-versed in security and you get the help and get it set up properly, that should really mitigate a lot of the risks that you have. And there's always concern, I get it, but we also need to think about moving forward.
I was going to say, Tim, a couple options that come to mind. If you do have a whole bunch of people that can work from home and they've vacated their offices, spread your call center out across the rest of those offices and the rest of the work spaces in the organization. Have half your call center work from home on Mondays, Wednesdays, and Fridays, the other half Tuesdays and Thursdays, and spread them out. Figure out if there are people that have lots of kids and they're never going to have a quiet space that's professional for what you guys need to do. Make exceptions for them to be in the office, but other people not, and make sure you've got cleaning procedures for turning over those workstations, offices, within the credit union as well.
Also, Kirk, regarding from the chat window regarding branch closings, we did see someone suggest here that if you have a drive-through, consider extending hours of those services. It requires less staff and it's safer from a social distancing perspective.
Yep, exactly. Also, you could put a couple of tables in front of your teller line so that there's an extra 2-3 feet that the person has to reach over, but that just creates some natural barriers. Or take your lobby line queue up thingies and put those a couple feet in advance, so you just add 2, 3, 4 feet between you and the teller. Easy things to do that make it really visible, that are easy to remember, that just help. They're not going to eliminate all the risk, but they're going to reduce it.
Right. So back to the one thing that I wanted to also comment about, the work from home and remote access for everyone. Don't just think of this as a one-time thing for this pandemic that we're dealing with here. This can actually be used in other types of events, whether it's inclement weather, people can't get in, they can to the office, they can still do work. Maybe it's some sort of natural disaster that you're dealing with. So think of it more of as an investment to your disaster recovery and business continuity planning. I understand, like I said, the security part, but if reach out to the professionals and get help to get it set up properly, and it'll help reduce the risk of the security issues. Another question here: what do you do if a member or employee tests positive for COVID-19? So this was one of the things that I had brought up with a lot of different credit unions that I'm talking with. Of course, once they've been tested positive for the COVID-19, it may be a few days after they've already been into the your branch location, and maybe if it's a member or if it's an employee, they've already been working there and interacting with members and other staff. So what you really want to do is, after they've gotten tested, of course, they're going to get into their quarantine, but we want to actually talk to your local public health and follow their protocol, which is basically going to be the closing the location, and the people that were part or interaction with this person, they're going to be put into quarantine to kind of monitor, find out what's going on. Now, we also need to take a look at seeking legal counsel. The reason I say that is because we want to make sure, and this ties back into making sure that we provide the gloves and supplies and things to make everybody have that safe workplace. But we want to make sure that should that employee or the member or somebody try to take legal recourse against us because they got the virus at the credit union, we want to make sure that we're set up, we're proactively monitoring and looking at that and making sure that we're ready should something of that happen. Now, if you have members that are coming in and exhibiting symptoms of the virus, and they're doing transactions or whatever it may be, you can kind of politely ask members to step away, and we can help them separately or whatever. The money, if they're or whatever they're touching, should be put into bags. You guys should have some like quart size or gallon size bags that you can put money or checks or whatever it may be into, and kind of ziplock them and keep them with should there be anything on them, contaminants, they're actually inside the bag and not spreading them around on teller lines, etc. Then the last one here: safety is our number one concern. Any legal issues during this time, we should keep in mind. And as I mentioned about the lawsuits, another thing is we also need to take a look at possible should one of our employees get the coronavirus while they will, get infected while they're working, if that's what it comes or leads back to. Then we need to take a look at, are we going to have to actually deal with filing, possible workman's compensation claims, et cetera? What are we doing? So the biggest thing is that you can do right now is make sure that you have all those supplies out there for your members, and also mainly for your staff, just to help protect them. Okay, so I think we've gotten through all of our questions here that were sent in previously. What other questions?
Yeah. So with that, guys, please go ahead and feel free to either type in your questions into that feature of GoToWebinar, or if you want to click the button to raise your hand, I can go ahead and unmute you if you want to ask Tim a question directly. Tim, while people are thinking about questions, either from Tim or Kirk or Shane, who's our security expert, does anyone have any other things they want to add? I know I was reading folks also should be aware of some pandemic phishing scams out circulating.
Yeah, Shane, if you could cover that off real quickly, that'd be great. And we're at a higher exposure the more employees we have working from home and potentially not always on credit union managed devices. If you could just touch base on that. I know we've got a newsletter coming out about that in the next few days as well.
Yep, sure. So, you know, the scammers and hackers love to take advantage of any good scare to get people to click, you know, before they've really analyzed it. So there is a large amount of phishing campaigns going around, you know, trying to invoke that fear to get folks to download documents, click on links, provide information, all, you know, under the guise of, you know, information from the CDC, WHO, those sorts of things. So, you know, communicating with your employees again to, you know, best email practices and you know, and anti-phishing and social engineering practices to not open things that they're not expecting. You know, always go to the source, you know, site to really review any sort of documents like that. Go to cdc.gov, who.int, and not open those things. There's also a duplicate page of the Johns Hopkins website, their map that we keep seeing all over the news that folks are linking to, both on, you know, in malicious ads as well as spam, that when folks visit that site, it downloads a banking Trojan to their our banking and information stealing Trojan. So we want to make sure our employees know to not you know, to be very vigilant in the links that they click, make sure that the sites are correct, and, you know, go to the sources to get their information and not click on things in email.
Thanks, Shane. With that, we got a question that came in for anyone on our team. Is there any guidance from regulatory agencies on proposed safe handling of cash?
Right now, I would take a look at, go out to the Federal Reserve and take a look at their contaminated cash policy and procedures. So not their policy, excuse me, their procedures. And you can follow that. Now, as far as the safe handling of cash, you could once again provide the gloves for your employees as they're handling the cash. I know everybody understands, you know, cash is really not the cleanest thing to be working with normally, but, you know, now with the virus that is spreading, a lot of people are concerned about people, you know, coughing and sneezing, et cetera, on money, and it could be contaminated. So one of the biggest things is, you know, you can let your staff wear gloves that are actually handling cash. And for those that may have payments and other things that are coming through the mail, you might want to also provide gloves to those persons that are actually dealing with the mail and also opening the mail and processing payments, et cetera, that may be actually dealing with information that's coming.
Yeah. And also just in terms of guidance, right, I do want to touch on, so the NCUA has put out a few articles there, and it's mostly about preparing for a pandemic. They have not gotten particularly specific to this point, but in terms of their presence in the field, they have confirmed that NCUA exams are something that they deem critical, but we have seen them roll back the amount of staff that they're sending on site to credit unions. We have not seen one canceled yet, but we've seen a reduction in the staff, and I think the likelihood is that they'll probably prioritize based on criticality, but they have not given any insight into canceling or postponing exams at this point in time.
No, and just to supplement that, John, they I believe their guidance also said, though, if you are running into staffing issues and need to postpone an exam, to contact your local regulator, and they'll work with you on that.
Thank you, Shane.
Awesome, thanks, guys. Next question that came in, we have, what do we do if a member comes to the branch and says that one of their family members has been contaminated? Do we call the health department?
Yes, definitely go ahead. Should anybody, one of the members, you know, contact you and say that, you know, we've been, or one of my family members has been contaminated, or they have the virus, they're infected, you want to reach out definitely to the local public health, human services, find out, let them know, you know, you get a name if you can, try to find out as much information you can from the person that's actually coming in, and relay this over to you know, local public health, and try to see what information you can get from them. They're, you know, they aren't necessarily that forthcoming with information, you know, people that they're monitoring, et cetera, but they may be able to give you a little guidance and they may send some people over to talk with your staff to try to figure out what happened, where, you know, who was actually engaged in conversation and waiting on that member when they came in.
Awesome. Thanks, Tim. We've got another one here on, I know you say to use gloves, but how often should they be changed or replaced if they touch their face and things around them? Are they not spreading the germs then?
Yes. So as long as they're sitting there and they're using and the gloves, counting the money, waiting on the members, and then you are correct. They are sitting there using their computer, touching their mouse and their keyboard, et cetera. So we need to make sure that we have things, wipes that or something that they can actually wipe down their areas as they go throughout the day. So it will help cut down on any of that cross contamination that you're referring to. And I would recommend, as soon as they leave the teller line, that they take those gloves off, they put them in their trash can or waste can right there, the receptacle near where they're at. And then when they come back to the teller line, they get a new pair of gloves. That way they're not wandering all over the branch or, you know, touching doorknobs and other things that they were touching, that they're using, the gloves that they're using, that they were touching the money with, to just try to help prevent the spread of germs.
So I'm not seeing any other questions coming in. I do want to give the quick update again that if you have any questions as they come to mind, please feel free to reach out to us at info@ongoingoperations.com. And also the fact that we will, after this, make these slides available for folks, as well as have the recording of this if you want to share it or reference it with anyone you work with. And also, of course, anyone who has an ongoing operations current BCP client who has questions for Tim on what might be missing in their plan, et cetera, and things they want to review. I know Tim has been in touch with a lot of you guys, but if you please don't hesitate to reach out. On that note, actually, one quick question just came in, Tim, so sorry to fake out the end here. We have one that says, we've closed our lobbies and only have drive-ups open. Are others in the situation from who you've spoken with, Tim? And if yes, what are you doing about shared branch transactions?
So right now there are a few credit unions that have actually went the way you did as far as closing the lobbies where they could. They do have some locations where they only have the lobby, so they've actually limited access into the lobby, but they're using drive-through. So they are letting people know out there on social media, on their websites, et cetera, that people can still access their funds should they need to get money through the ATM. They have online services, plus they are, you know, letting people know that they could go to a shared branch location if needed. But like one of the other persons on the call here had mentioned, you know, extending hours for your drive-through will definitely help, because, you know, the lines are going to get a little bit longer and move a little bit slower in drive-through. So that will help kind of cut down some of the anxiety and frustration with people, you know, waiting longer in your drive-through. But you can definitely, you know, use all the different resources that you have available at your fingertips, you know, whether it's shared branching, ATMs, whatever it may be.
And with that, I will actually say I don't see any more questions at this point. As I mentioned, of course, our current clients, please feel free to reach out to Tim and Mark and our entire BCP team if you have any questions. We're also going to be starting up weekly roundtables that are beginning this Wednesday on 3/18 that are available for our current BCP clients. And we're going to have a panel of current credit unions sharing best practices during this tumultuous time. So for information on that, we'll go ahead and include that in our follow-up email to you guys along with these slides if you want to register. And it'll also be on our events page on ongoingoperations.com. So please don't hesitate to reach out. Now, on a quick note, sorry, Tim, one more question rolling in. We have a member who would like to talk to others who have closed their lobbies. Would anyone on this call be willing to share who had already made this decision? And if so, you know, I can put you guys in touch. So if anybody is willing to share about this, please feel free to enter that in the chat or email me at info@ongoingoperations.com, and I can go ahead and connect you with another exec who is looking at this potential of closing lobbies. Oh, and for Karen, I've got someone here who can be reached for closing, Peg Lamb, so I can give you her contact information. All right, so with that, I have nothing else. Tim, anyone on our senior team here want any closing thoughts before we all log off? I know everyone's busy and has lots to do.
Just remain vigilant and don't panic. That's the main thing. Okay.
All right, wonderful, guys. So again, if anyone has any questions, comments, concerns, we'll be emailing shortly out the presentation after, along with the recording. And please don't hesitate to reach out to our team if there's any way that we can help during this challenging time. You know, we're here as a community to all work through it together. And thank you for joining our pandemic update.
All right. Thank you, Amy.